According to the American Cancer Society, 1 in 7 men in the United States will be diagnosed with prostate cancer during their lifetime. This morning, we have Dr. Jeffrey Albaugh and Tom Kirk, President and CEO of USO International, here to share advice on how patients and caregivers can get help and support. Good morning, Dr. Albaugh and Tom.
Good morning, Carly.
So this is pretty scary when you hear this number about prostate cancer and really how many men are going to be diagnosed with this. Kind of a high number.
Yes, prostate cancer is the #1 non-skin cancer in men. And so pretty much everybody probably knows someone who has had prostate cancer. Remember, millions of people in the United States have prostate cancer as well as across the world.
Yeah. Well, now, is there a cause for it yet? Or are there certain things that men need to stay away from? Have we gotten any further in finding out more about this?
Well, in general, we know that men with a family history of prostate cancer, just as with breast cancer, are more likely to develop prostate cancer and have a higher risk of that. So they should work with their healthcare provider about when to screen and how often to screen. Also, African Americans have a higher risk for prostate cancer. So, and sometimes people like Vietnam vets who've been exposed to Agent Orange, but some of these groups have a higher risk. It doesn't mean they'll get prostate cancer, but they have a higher risk for prostate cancer. So living healthy can be important, but even the healthiest people may be diagnosed with prostate cancer.
Well, isn't the biggest thing too early detection? How important is that?
Absolutely, because early on there are no symptoms with prostate cancer, and that's where it becomes very important to sit down with your provider and determine. There's 2 pieces to it at this point with screening, which is a blood test and a physical exam, and the combination of that is what you want. But you have to talk to your provider about when should I get that first baseline screening and how often should I be screened according to your particular history.
Well, and tell us about this USO International and what the goal and the mission is with that group.
You bet, Carly. We were formed 25 years ago here in Chicago by a group of men and their family members who had prostate cancer. So when we talk about affected by prostate cancer, us too. We're people who understand. We are people that you can talk to. So we're best known for this series of over 300 support groups spread around the country in communities. We're also known for our website, which we want to acquaint people with today, and that's USTOO.org, USTOO.org, where you can find where a support group is in your community, or you can join a social community where you can get questions answered, or you can also call us at a helpline where you can find information if you're not so tech savvy.
Mm-hmm. Well, and how important are support groups? You hear about them a lot.
Well, I'll tell you something very candidly, that it's not too infrequent when I hear men actually saying, USO saved my life. Because what we know is engaging people who've been down the pathway, the veterans who've been experienced in their own cancer, are valuable resources to help people not panic or not run and hide. As men, we get trained, of course, to be strong and silent. And when you have a cancer diagnosis, visit your family, it's not a time to run and panic. It's not a time to be strong and silent. It's a time to pull your team together, to be the quarterback of your team. And all of that information is available for people. And there are literally millions of people who are willing to help you tell their story and show you the positive way they've turned their lives around to deal with this diagnosis.
And that is an interesting fact, because I think that men do have a tendency to be closed off, and women tend to be more open and more willing to go to a support group. But I love the encouragement for men here to do the same.
Exactly, and that's why women also need to learn information about prostate cancer, not only for their husbands or their fathers, but their own children as we get older here. And as Dr. Albaugh mentioned, families that have the disease within their family are at higher risk.
Yeah. Well, as we close here again, I know you mentioned the website, but what do you want people to really know and understand? And certainly, where do you want them to go for more information?
Sure. www.USTOO.org.
For those who are less internet savvy, they can call 800-808-7866, which is the helpline for USO.
All right, Dr. Albaugh and Tom, thank you so much for joining us this morning.
Thanks for spreading the word, Carly.
We, of course, will put all that info on our website as well, fox4morningblend.com.
And one last look at your Fox forecast, and then we'll be right back.